7:45 right now. As the COVID-19 crisis evolves, many people with other health issues may not be getting the care they need out of fear of contracting the coronavirus. Now, 6 of LA's major healthcare providers have come together to form the LA Consortium with a mission to put health first.
For those who stay in and those who work through the night, for those who share their food and comfort, their hopes and fears, for all you've done in this great city of angels, we see you and appreciate you. Life may
And joining us now is Julie Sprengel from Dignity Health, as well as Eric Wexler of Providence, Southern California. Welcome to both of you.
Good morning, Tony.
All right, I'm going to start with you, Eric. What exactly is the LA Consortium and why is it important?
Well, this is a group of the largest healthcare providers across LA County. It includes UCLA, Cedars, USC Keck, Kaiser Permanente, and of course, Dignity and Providence. And we've come together because we know that we need to care for our communities during this COVID crisis. And in fact, there's a silent epidemic out there of people that have diseases and illnesses that haven't been coming to the hospital or seeing their physicians during this time. And it's actually increased their illnesses and put them significantly at risk. So we've come together as partners, try to do the right thing for the community and make sure they're educated and that they know our hospitals and our clinics are safe.
Well, and Julie, I guess that's the question for you. I mean, how do people know that the hospitals are safe? Obviously, they're concerned that there may be people there who are being treated for COVID-19 at these various hospital institutions.
Absolutely. All of our hospitals agree our #1 priority is patient safety. So we've taken great lengths to make sure that when our patients visit us, they will be in a safe environment, whether that's taking their temperature on arrival, disinfecting our facilities, assessing for signs and symptoms of COVID, and separating those patients who either have signs and symptoms or are already positive for COVID from other patients. And most importantly, testing, right? We are testing all of the patients who come in prior to having an elective procedure or a surgery. But you know what's most important about that is if they don't come in and they're missing a sign and symptom, right? If they're having numbness or tingling, shortness of breath, chest pain, a headache, all of those could be signs and symptoms of something much larger, like diabetes or high blood pressure or even cancer, that could have more long-term effects on their health and need to be treated and no longer ignored.
Well, and Julie, the fact of the matter is, even though people are not coming into the hospitals at the rate that they had been prior to this pandemic, the fact of the matter is heart attacks are not stopping, strokes are not stopping. And so those things need to be addressed.
Correct. We've all heard the unfortunate stories of catastrophic things happening at home where people are waiting until the last minute because they're scared of COVID. Believe me, we all understand in healthcare that COVID is scary. But what is also scary is the long-term effects on your health. No different than when you go to the grocery store because you need to buy food for nourishment. You also need to take care of your body. Don't ignore the warning signs, because it will lead to something much greater and possibly even death.
Eric, let me ask you this. If people don't start going to hospitals for treatment of things that obviously need to be taken care of, what are the implications for society at large? Could this lead to a much larger problem down the road for all of us?
Absolutely. There are other diseases that are transmittable, infections that are transmittable. But, you know, the serious conditions which Julie spoke about are probably the biggest implications. We had a patient that came to one of our hospitals that had been suffering symptoms of stroke and thought she could tough it out at home. And by the time she got to us, it was beyond the window for us to provide the right type of pharmaceuticals to bust that stroke, clot bust that stroke, and allow the patient to continue to have a productive life. And so she's now permanently paralyzed. So, you know, a lot of the worry we have is people just fearing that if they come to our hospitals, they may get COVID-19. But in fact, as Julie described, we are quite good and in fact have worked at this for decades and decades in preventing viruses from spreading in our hospitals, we are probably one of the safest places that patients can come. So if people do not take care of themselves, this silent epidemic of heart disease, cancer, and other things that can affect people and potentially put their lives at risk will increase significantly.
All right, and although we're out of time here, I do want to get this particular fact out there. One of the things I know that you guys are particularly concerned about is parents not having their kids vaccinated on time, and I know you both are encouraging parents to keep up with their kids' immunizations. That is vitally important during this time. I want to thank you both, Julie, and Eric, for joining us this morning. Really appreciate it. You guys have a good day. I think this is a good idea, and both of you, please stay safe.
Thanks, Tony.
Thank you.